You may not often think about the signs of diabetes that can appear at night. However, understanding the symptoms of this common yet serious health issue can make a significant difference. Today, we will explore the subtle but significant signs of diabetes that often occur during the night. These nighttime indications offer valuable information about possible underlying health problems. First of all, one of the primary symptoms of diabetes is usually increased urination. If you find yourself waking up several times during the night to empty your bladder, your sleep pattern could be altered, which may be a sign of diabetes. This happens because, with diabetes, excess sugar or glucose builds up in your bloodstream. Your kidneys have to work overtime to filter and absorb this excess sugar. If the kidneys cannot manage the excess glucose, it is excreted in urine, drawing fluids from your body, which increases the frequency of urination. This physiological response is your body's attempt to eliminate the excess sugar and can be a warning sign of diabetes. Night sweats are another crucial symptom to which we must pay attention. If you frequently wake up in the middle of the night sweating, this could be an indicative sign of diabetes. Night sweats usually occur due to low blood sugar levels during the night, a condition known as nocturnal hypoglycemia. This happens when your body releases emergency hormones in response to low blood sugar, causing excessive sweating. Adjusting the dosage of medications and your eating habits can help manage night sweats in diabetics. However, these changes should only be made under professional supervision. Before we move on to the next symptom, don't forget to like and subscribe. Thirdly, symptoms of hypoglycemia include not only sweating and shivering but also a noticeable increase in hunger. Other symptoms can include confusion, blurred vision, and even heart palpitations. Hypoglycemia is a more frequent condition associated with diabetes. The reason these symptoms appear mainly at night is due to the body's energy needs while resting. When glucose levels drop, the body responds by exhibiting these symptoms to signal the need for an increase in blood sugar. Managing these symptoms involves regular monitoring of blood sugar levels and maintaining a balanced diet. It is also crucial to discuss any medications with health professionals, as some medications can affect blood sugar levels. In some cases, a nightly snack containing complex carbohydrates and proteins may be recommended to help keep blood sugar levels stable throughout the night. The next sign is restless leg syndrome, a neurological disorder that is often underrated but quite concerning. This condition is characterized by an uncontrollable and irresistible urge to move your legs, usually accompanied by strange and uncomfortable sensations in the deep leg muscles. These sensations can be quite difficult to describe and have been compared to tickling, pain, or even a sense of fear. You may be wondering about the link between this syndrome and diabetes. The connection lies in the nerves. Persistently high blood sugar levels, characteristic of diabetes, can damage the nerves over time. This condition, known as peripheral neuropathy, is a common complication of diabetes and can lead to the development of restless leg syndrome. Damaged nerves send contradictory signals to the brain, which leads to the feeling of needing to move your legs constantly. Therefore, if you experience discomfort or an irresistible urge to move your legs, it may be a good idea to monitor your blood sugar levels. Lastly, a sleep disorder known as sleep apnea ranks fifth on our list. This condition is characterized by frequent pauses in breathing during sleep. These pauses, or apneas, can occur several times throughout the night, resulting in interrupted sleep and often leaving the individual feeling tired during the day. The relationship between sleep apnea and diabetes is particularly significant, as scientific research has shown a notable correlation. It has been shown that people with diabetes, particularly type 2, are much more prone to sleep apnea. The reasons behind this are multiple. A key factor is that both conditions are associated with obesity. When excess fat builds up around the neck, it can obstruct the airways, leading to sleep apnea, as well as disturbances in metabolic factors caused by diabetes. Insulin resistance can contribute directly to the development of sleep apnea. Resistance to insulin can cause imbalances in the body's energy consumption during sleep, resulting in interruptions in breathing. This complex interaction of factors leads to an increased risk of sleep apnea in people with diabetes. Continuing, we come to the symptom of increased thirst, also known as polydipsia. If you frequently wake up at night with a dry mouth and feel unusually thirsty, this could be a telltale sign of diabetes. This occurs due to high blood sugar levels, which force the kidneys to work overtime to filter and absorb the excess sugar. When they can't keep up, the excess sugar is excreted in urine, drawing fluids from your tissues. This leads to more urination, which can cause dehydration, resulting in increased thirst. Managing this particular symptom involves controlling blood sugar levels. Regular follow-ups, a balanced diet, regular physical activity, and medications prescribed by your doctor are essential. Consult your doctor for better ways to manage your symptoms. Don't ignore increased thirst, especially if it is accompanied by other symptoms of diabetes, because your body is signaling that something is wrong. The seventh sign to pay attention to is fatigue. If you feel constantly tired despite getting enough sleep, this can be an indication of diabetes-associated fatigue. This fatigue is caused by the body's inability to use glucose as a source of energy. When your body can't convert food into energy due to a lack of insulin or insulin resistance, you may feel tired all the time. This is because the cells are deprived of the glucose they need to function optimally. Managing fatigue associated with diabetes involves maintaining stable blood sugar levels, which can be achieved through physical activity, a balanced diet, and regular checkups with your healthcare professional. It is important to ensure that your body gets enough rest and that stress levels are kept to a minimum. Relaxation and stress management are also crucial for controlling fatigue associated with diabetes. Medically known as xerostomia, dry mouth is another notable symptom to be aware of. It is characterized by an absence of saliva, and people may frequently wake up with a dry mouth despite maintaining adequate hydration levels. This could potentially be a sign of diabetes. This symptom occurs because high blood sugar levels can decrease saliva production, leading to dry mouth. Additionally, high blood sugar can cause an increase in urination, which can lead to dehydration and subsequently dry mouth. Managing this symptom involves maintaining good oral hygiene, staying well hydrated, and using saliva substitutes or stimulants if necessary. Chewing sugar-free gum or sucking on sugar-free candy can also help stimulate saliva production. It is always recommended to consult with a healthcare professional for an accurate diagnosis and treatment of this condition. The last point to consider is the appearance of sleep disorders. If you suffer from insomnia or face other nighttime concerns, these could likely be related to diabetes. Chronic sleep disorders are often seen in people with diabetes due to the body's inability to regulate blood sugar levels, which can cause hypoglycemia or nocturnal hyperglycemia. Low blood sugar or hypoglycemia can trigger symptoms such as sweating and tremors that may wake you up in the middle of the night. On the other hand, hyperglycemia, or high blood sugar levels, can lead to frequent urination, resulting in multiple trips to the bathroom at night. Managing these sleep disorders usually involves improving blood sugar control through medications, dietary changes, and exercise. Therapies such as cognitive behavioral therapy can also be beneficial in combating insomnia. Therefore, if you have sleeping problems, it is essential to consider the possibility of developing diabetes and consult a healthcare professional to obtain a diagnosed and precise treatment. In summary, the signs of diabetes that may appear at night include frequent urination, night sweats, symptoms of hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, fatigue, dry mouth, and sleep problems. Remember, these symptoms are not definitive proof of diabetes but may indicate the need for medical consultation. It is always best to consult a professional. If you experience any of these symptoms, it is essential to consult a healthcare professional. Diabetes is a disease affecting millions of people worldwide. Watching for the signs, especially those that occur at night, can aid in detection and early treatment. Don't forget to give a thumbs up and subscribe if you liked the video.